Hello, my name is Gerald Spence. I'm the CRTA Deputy Registrar, and this is the mandatory continuing competency for the renewal period April 1st, 2024 to March 21st, 2025, and the topic is restricted activities for the CRTA registrant. The definitions and the material for this presentation are sourced from Alberta legislation and regulations that govern the authorization and performance of restricted activities. The links are below. The Health Professions Act, the Health Professions Restricted Activity Regulation, part of the HPA, the Respiratory Therapist Professional Regulation, and the Pharmacy and Drug Act. The following definitions will help us to understand restricted activities. The first is activity of daily living, which means an activity that individuals normally perform on their own behalf to maintain their health and well-being, and could include routine and invasive self-care activities, including but not restricted to the removal of slivers and the cleaning of wounds, specifically taught procedures, which generally result in predictable and stable responses, including but not restricted to catheterization, maintenance of drainage tubes, and administration of drugs by injection. Administration of a drug means supplying of a dose of a drug to a person for the purpose of immediate ingestion, application, inhalation, insertion, instillation, or injection. And the term assisting means a regulated member of another college or a physician is on site directing the procedure being performed. Competence means the combined knowledge, skills, attitude, and judgment required to provide professional services. This is the definition from the Health Professions Act. Competent means the registrant is adequately qualified, suitably trained, and has sufficient experience to safely perform work without supervision. Conduct includes an act or omission. And drug means a substance or combination of substances referred to in the Pharmacy and Drug Act, or defined as an emergency release drug or a special access drug, and any combination of such a substance or substances. Health service means a service provided to people to protect, promote, or maintain their health, to prevent illness, to diagnose, treat, or rehabilitate, to take care of the health needs of the ill, disabled, or dying. Registrant means a person who is registered as a member under Section 33(1)(a) of the Health Professions Act. Regulated profession means a profession that is regulated by this Health Professions Act. A restricted activity means an activity named as a restricted activity in Section 1.3 of the Health Professions Act. And restricted activities are high-risk activities performed as part of providing a health service that requires specific competencies to be carried out safely by authorized persons. The following are restricted activities identified in the Health Professions Act. The first is to cut a body tissue, to administer anything by an invasive procedure on body tissue, or to perform surgical or other invasive procedures on body tissue, either below the dermis or the mucous membrane, or below the surface of the cornea, or in or below the surface of teeth, including the scaling of teeth. The next restricted activity is to insert or remove instruments, devices, fingers, or hands beyond the cartilaginous portion of the ear canal, beyond the point of nasal passages where they normally narrow, beyond the pharynx, beyond the opening of the urethra, beyond the labia majora, beyond the anal verge, or into an artificial opening on the body. And further to the previous restricted activity, to insert into the ear canal under pressure, liquid, air, or gas, or a substance that subsequently solidifies. And they continue to set or reset a fracture of a bone, to reduce a dislocation of a joint, except for the partial dislocation of the joints of fingers and toes, to use a deliberate, brief, fast thrust to move the joints of the spine beyond their normal range, but within the anatomical range of motion, which generally results in an audible click or pop, to prescribe a Schedule I drug within the meaning of the Pharmacy and Drug Act, to dispense, compound, provide for selling, or sell a Schedule I drug or Schedule II drug within the meaning of the Pharmacy and Drug Act. If you look, the rest of the restricted activities are to administer a vaccine or parental nutrition, to prescribe, compound, or administer blood or blood products, to prescribe or administer diagnostic imaging contrast agents, to prescribe or administer anesthetic gases, including nitrous oxide, for the purposes of anesthesia or sedation, to prescribe or administer radiopharmaceuticals, radio-labeled substances, radioactive gases, or radioaerosols, to order or apply any form of ionizing radiation in medical radiography, nuclear medicine, or radiation therapy. They continue, N, to order or apply non-ionizing radiation in lithotripsy, MRI imaging, or ultrasound imaging, including any application of ultrasound to a fetus. O, to prescribe or fit an orthodontic or periodontal appliance, a fixed or removable partial or complete denture, an implant-supported prosthesis. P, to perform a psychosocial intervention with an expectation of treating a substantial disorder of thought, mood, perception, orientation, or memory that grossly impairs judgment, behavior, capacity to recognize reality, or ability to meet the ordinary demands of life. To manage or deliver a baby. To prescribe or dispense corrective lenses. Despite Section 2.1, the following are not restricted activities. Activities of daily living, whether performed by the individual or by a surrogate for the individual. Giving information, providing advice with the intent of enhancing personal development, providing emotional support, or promoting spiritual growth of individuals, couples, families, and groups, and drawing venous blood. So we've looked at what restricted activities are in Alberta, but how does this list apply to us in the profession of respiratory therapy? Well, Section 2.1 says for the purposes of Part 0.1 and Section 134.1 F1, regulated members of each health profession may perform the restricted activities within the practice of the respective profession as set out in this regulation. So if you go to the regulation on restricted activities, there's a section for respiratory therapy, and we can do those restricted activities as we practice. 2.2. Regulated members must perform only those restricted activities that they are authorized and competent to perform and are appropriate to the practice of the respective profession under the Act and this regulation. And 2.3 says regulated members must perform the restricted activities in accordance with the standards of practice and must meet the requirements for demonstrating competence as established by the Council under the Act and this regulation. Just a couple more comments in the regulation about the performance of restricted activities. Despite authorization to perform restricted activities, registrants must restrict themselves in performing restricted activities to those activities they are competent to perform and to those that are appropriate to the registrant, that is, the member's area of practice and the procedure being performed. You wouldn't intubate someone in a PF lab, right? Because there's no crossover there. And additionally, registrants must perform restricted activities in accordance with the standards of practice and employer policies and procedures. It's time now to move from broad to specific. Here are the restricted activities identified for respiratory therapists. So the first is to cut a body tissue, to administer anything by an invasive procedure on body tissue, or to perform surgical or other invasive procedures on body tissue below the dermis of the mucous membrane for the following purposes. For performing blood analysis, assisting with cardiac procedures, performing hemodynamic monitoring, assisting with anesthesia, administering injections, suturing, performing routine wound care. So this is an activity that all respiratory therapists are authorized to do. They wouldn't do them unless they were both authorized and competent. Okay, we continue with the basic authorizations. B is to insert or remove instruments, devices, fingers, or hands beyond the point in the nasal passages where they normally narrow and beyond the pharynx for the purpose of inserting or removing tubes. C is to administer blood or blood products when assisting with anesthesia. D is to administer anesthetic gases, including nitrous oxide, for the purposes of anesthesia or sedation when assisting with the provision of anesthesia or bronchodilation. Next, we move to the restricted activities that require advanced training and authorization. Section 64.1 and 64.2 state that the regulated member referred to in section 63.2, who has provided evidence satisfactory to the registrar of having completed and remaining current in the advanced training required by the council, and has received notification from the registrar that authorization is indicated on the appropriate category of the regulated members register, may perform these restricted activity in accordance with the standards of practice, the restricted activities listed in subsection 2, for the purposes of performing ECMO, needle thoracentesis, and insertion and maintenance of chest tubes. There will be a form on this year's renewal that the registrant can fill out requesting authorization for these type of restricted activities. The manager must respond to the college letting us know that this person has the training and is still competent to perform them. For the purpose of this section, a regulated member, referred to in subsection 1, may perform the following restricted activities: to cut a body tissue, to administer anything by an invasive procedure on body tissue, or to perform surgical or other invasive procedures on body tissue below the dermis for the purpose of insertion and maintenance of chest tubes, insertion of central venous catheters, and needle thoracentesis. To insert or remove instruments, devices, fingers, or hands into an artificial body opening into the body for the purpose of insertion and maintenance of chest tubes, insertion of CVP catheters, and needle thoracentesis. To administer blood or blood products for the purpose of ECMO. to order any form of ionizing radiation for the purpose of ordering a chest X-ray. These are over and above the regular restricted activities of a registrant. Now we talk about the application of non-ionizing radiation ultrasound. The first thing we have to understand is registered respiratory therapists are not authorized to perform the restricted activity to order or apply non-ionizing radiation, section 2(1) bracket N. But the College of Physicians and Surgeons standard of practice for restricted activities does allow for physicians to consent to supervise other regulated health professionals who are not authorized to perform this activity. A physician may consent to supervising a person performing a restricted activity if that person is, and you can see another regulated healthcare professional. We are regulated healthcare professionals, and we can be supervised by physicians. They can also supervise clinical trainees or unregulated healthcare providers. So the physician who supervises, they must be competent, they must be authorized, they must be satisfied with your knowledge, skill, and judgment, and they are responsible for the restricted activity performed by you. They have to ensure it's safe and appropriate for you to perform the restricted activity on a particular patient, and they have to obtain the patient's informed consent for the restricted activity to be performed under supervision unless there's an emergency. This next slide addresses supervision that you will be performing as a respiratory therapist when your learners are performing restricted activities. So the first thing you need to understand is supervision can be defined as the act of watching a person perform an activity to make certain that everything is done correctly and safely. So who can you supervise as a respiratory therapist? You can supervise a student who is enrolled in an RT program of studies approved by the council. You can supervise a registrant, could be a colleague, who is learning to perform a restricted activity in a program approved by the council, or a student in post-secondary health services program of studies approved by a council of another college. If you are going to supervise someone doing a restricted activity, you have to be engaged or approved to supervise by an organization that offers the program of studies. You have to be authorized to perform the restricted activity being performed, and you have to be either present in the room and available to assist, or if you're not present in the room, available for consultation. If you're going to be not readily available, you need to be of the opinion that the student or the registrant who is training is able to perform the restricted activity safely and effectively. And finally, registrants cannot supervise students performing restricted activities unless the supervising registrant is authorized and competent to perform that activity. In other words, respiratory therapists cannot supervise learners for the restricted activity to order or apply non-ionizing radiation. Supervision of non-regulated persons performing a restricted activity. Respiratory therapists are authorized to supervise non-regulated people for the restricted activity of inserting or removing instruments, devices, fingers, or hands beyond the pointed nasal passages where they normally narrow and beyond the pharynx for purposes of suctioning only in the airway management. You can only supervise if that person has the consent of and is being supervised by a registrant of the college while performing this activity. So basically, the only activity that's restricted we can supervise would be a non-regulated person suctioning the airway. You should be available for consultation, or if you're not readily available, you need to be of the opinion that the person you're supervising is safe to perform the activity. This ends the presentation.